Hello, my name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by two physical therapists, Lisa Long and Sue Dodge, and we're going to be talking about two interesting therapy techniques that you, and maybe me, have never heard of. So welcome.
Thank you.
It's great to have you both here. So before we get started into the conversation of the therapy techniques, maybe if you could introduce yourselves and tell us a little bit about who you are, how long you've been at Northwestern Medical Center, et cetera.
My name is Lisa Long. I've been with NMC for about 4.5 years. I've been a PT for about 8 years. I work primarily out of the Enosburg office.
Great, that's right. That's right, we're located in a couple, well, actually a few different places, aren't we?
Yes.
And Sue, you're going to talk about where you are, which will expand us as well.
So I am a physical therapist, and I work out of the Georgia satellite office. I've been there since December, so not very long. I'm new to the organization. I did work here previously as a traveler a couple years ago and decided to come on board. I've been a physical therapist for 35 plus years. So.
Great, so we got some great experience. So we're located in St. Albans and Enosburg, Georgia, and we're also a little bit at the pool too. We have some therapists there. Are those our sites?
Yep, I believe so.
All right, you might find us in the schools a little bit too, but okay, fantastic. All right, so tell me a little bit about Northwestern Orthopedics and Rehabilitation Team and what that team is like and what do you do as an integrated team?
We're a big team. Primarily, most of our therapists are located in the Cobblestone building near the orthopedic with those guys. So working out of a satellite office means we still get to work closely with the doctors, the PAs, the nurses, the medical staff, everyone to help the patients accomplish their goals, which primarily means feeling better, getting moving, getting stronger. It's a great team and it's a fun to be a part of.
Right. Yeah. And how do you fit in in Georgia? Because you're mostly there, right?
Mostly in Georgia. I would say similar. Most of the referrals actually come from the orthopedic department, as well as Georgia Urgent Care and the Georgia Health Center.
Okay.
So we have a variety of referral sources, and we work closely with those teams.
Excellent. Thank you. All right, so let's jump in to our topics of interest, and we're going to start with the Graston Technique. So I see you have tools there.
Yes, we have a variety of different tools.
So Sue's jumping in and telling us about this technique.
There's 6 different tools that we use. Basically, Graston is a method of instrument-assisted soft tissue mobilization. So we use the tools. And there are different tools with different shapes and nodules that are beveled in a certain way that help us to diagnose as well as treat soft tissue injury. So what we can do is we can feel different tissue restrictions, either scar tissue restrictions or fascia, which is our connective tissue restrictions. And by feeling them, then we can then go ahead and treat them by breaking up the scar tissue and sort of reorganizing it.
So what's scar tissue?
So tissue in general is can be either very linear and such as like tendons and ligaments, or it can be loosely configured. But scar tissue is when an area is injured and then it heals in sort of a haphazard method, and it's sort of all entangled. And so what we're trying to do is get that to be in a more organized fashion so that sensory input becomes normalized again, the tissue, the way it contracts becomes more normalized.
So just describe a soft tissue injury, just pick one that you might see, and then maybe how does this tool work?
Yep.
So describe one, whether it's an arm or knee or whatever.
Yeah, so for example, Achilles tendonitis.
Okay, perfect.
So that is basically an inflammation of the tendon that attaches your calf to your heel.
Okay.
Oftentimes people have very tight calf muscles, And so it's pulling on that tendon.
Okay.
So what we do is we go through the calf with, say, this tool.
Say you're working with the Achilles right now.
And I'm sort of just kind of moving this tool along the surface, and you can feel different restrictions. And what it feels like, it feels gritty, I guess would be the way I would describe it.
Okay.
So we find these areas, and then we work on the tissue to kind of level it out. And what happens is initially we'll just do soft tissue work, and then we have the patient do stretches or strengthening exercises. Mm-hmm. A way to heal a tendon is basically through the action of the muscle. So we're not really necessarily working with a tool on the tendon, but on the muscle that attaches the tendon to the bone. To go from injury to back to full function, we then have the patient go through a series of exercises while doing the tool at the same time. So they may be doing a calf stretch, and I'm working the muscle at the same time.
Stretching the calf, and then you're moving that tool up
along the calf muscle.
Along the calf.
Yep.
Okay.
And then we would progress to having them do what's called eccentric heel raises. So they'll go up on both feet, up on their toes, and then lower down slowly to strengthen the calf muscle while we're using the Graston tools.
So how do you know which tool to use? It looks like you have a few different
We do have a lot of different
there.
options. There are a few that are my favorites, this being one of them.
Mm-hmm.
There's just very good contact with the muscle throughout, so it's really more comfortable for the patient. Larger areas, we will use this tool, and you really can get a lot of pressure down in there, and it's actually quite comfortable.
What does the patient feel? Does it feel good, or does it?
So it used to be that Graston was painful, and the way to get better was to actually bruise the patient. They're not teaching that anymore. It really is. It may be a little bit uncomfortable, just like any sort of manual therapy could be, such as deep massage, but it's not supposed to be painful. And I actually find it sort of relaxing, depending on how deep you're working the tissue. So
does this get better results than using your hands? I mean,
yes.
So why
use this versus my hands? One, it actually helps diagnose better, because I can feel more through the tool than I can with my fingers.
Okay.
In addition, it's actually more comfortable for the patient, because this is like a continuous surface. Like when I put this down, I know that this is the contact that I have on the patient. When I'm using my hands, this finger may put more pressure than this finger. I'm sort of digging into the patient. It's uneven. It's not as uniform, so it's less comfortable. And I think the other thing is that you get more sort of continuity of treatment in terms of how you're treating. But there are different, like this I would use more to get into like nodules, like up in the groove here where this tool wouldn't fit.
Sure.
So you can get into a lot of different places.
So from the patient's perspective, so people who are listening to this, what is the benefit to them for you using these tools, would you say?
They heal quicker.
Heal quicker.
Quicker, and I would say more thoroughly.
Okay.
Yeah.
Interesting.
Get back to their sports quicker, get back to life quicker.
Nice. Excellent. That's great. Great. Well, let me flip to dry needling, because we're talking about two things, and our time always flies when we have such interesting conversations, and I'm afraid I want to make sure we get enough time for everything. So what is dry needling? What does that entail?
So dry needling, like the Graston Technique, is another tool in the toolbox to be able to help people with pain and dysfunction. Dry needling is a technique where you actually insert a thin filament needle into the skin to help treat pain and dysfunction. So when you do that, what happens is that puncture in the skin, in the tissue, creates this little micro lesion. Then that lesion helps create the circulation and the body's own healing process, which again, just like Graston, another technique to help the patient heal quicker.
So I got a lot of questions.
Yes.
So how do you know which therapy to use? whether it's Graston or dry needling?
It's patient dependent. It's the presentation of what's going on. Someone who is not appropriate for needling might feel better about the Graston tools. Someone maybe is more of a candidate for a manual technique. Someone might be more Therex, and so it just depends on the patient.
On the patient,
Yeah.
and you talk
And
with
the
them, and you
Absolutely.
what they're comfortable. So, how is this different than like acupuncture? And it feels like you're putting these little filaments in, and it sounds so familiar. It sounds similar to me. So,
I mean, the way that I kind of think of it as being different is acupuncture is really based on Eastern philosophy, Eastern medicine, where you're looking at energy fields and meridians. So, for example, if you had a headache, an acupuncturist may put a needle here in your thumb. Mm-hmm. With dry needling, and what we do as physical therapists is it's more direct. It's more of a mechanical effect. So if you have a trigger point or a nodule, or a muscle.
what is a trigger point?
It's a small band of tissue that is kind of firing abnormally.
Okay.
And we want to reset that muscle. We will actually take the needle and put it into that trigger point. So
Okay.
it's very direct.
Okay.
Versus
and then when you put it into that trigger point,
it resets the muscle.
Oh, okay. All right.
And so it's sort of, the patient may feel a little bit of like a muscle cramp or a twitch, and then the muscle often will just sort of let go. And then they get sort of a relaxation response.
Interesting.
Yeah.
So we talked a little bit about why one over the other. So when you size somebody up, who more benefits from dry needling or Graston Technique, or do you have any sense about that when you actually, meet patients and understand their injuries? So how do you select the technique? I understand it's like conversation, but is there one benefit over another, or?
I mean, oftentimes I'll use them in combination.
Really? Okay.
Yes. So I tend to go with more of a Graston sort of technique first, being that with dry needling you're puncturing the skin, so it's
Invasive.
it's more invasive, a little bit more
invasive,
invasive. But I do find that people who respond well to Graston also respond very well to dry needling. So the combination of the two I find to be really effective, especially with musculoskeletal injuries.
So you have to have a lot of great experience and intuition and really connecting with a patient to understand if it's individual, if it's together, or how you do this, right? I mean,
Yeah.
to size this up.
Yeah, we get to know our patients pretty well.
Yeah.
It sounds like it. Anything else that the community should know on either of these two techniques when they're thinking about physical therapy, or the why behind it? Why might they use these techniques, or what are they presenting with?
They both require training above and beyond the school, out of regular PT school.
That's nice to
So we are both certified in dry needling. Sue's certified in Graston Technique, I
Okay.
believe. So they take training above and beyond. So not only are we educated and know the anatomy and all of the basic stuff, it's above and beyond training. So
Okay.
an extra tool to be able to use.
So extra certification
Correct.
for
Yes.
these techniques. So with our viewers, if they're excited about all of this and these new opportunities, how do they go about accessing your services?
Well, it would be coming to NMC to have a physical therapy evaluation and becoming a patient. So depending on your insurance, going about it via your doctor's office, or if you could be self-referred.
So they check their insurance, they might be able to self-refer?
Correct.
Or through the doctor's office?
Yes.
Okay. Wow. This is really cool stuff, isn't it? I mean, I keep,
It is
when you're talking,
fascinating,
I keep
yes.
thinking about some of the things I've had, the Achilles piece to it, and I'm like, oh, that might have been really
Yeah.
cool to do. So what do you do as we wrap up our time together? What do you do for fun? Each of you to stay in great health, and because that's what we're trying to get people back to their optimal wellness and fitness. And so what do you do?
I enjoy skiing and hiking and running with my family.
Excellent.
Those are, Yes.
So you stay busy for sure.
Stay busy,
Active.
especially this time of year,
Yeah.
so with the snow flying.
It's flying, that's
Yes.
for sure.
I do pretty much anything outdoors. I love to run, do some ultra running, marathon running, cycling, hiking, planning a trip to the Grand Canyon next in October. So we're gonna run rim to rim in the Grand
Rim
Canyon.
to rim.
Yeah.
Whew.
Yeah. So that's
Wow.
exciting. So yeah,
That is
so
terrific.
I need to stay healthy as well. So using the tools on myself sometimes and
Yes,
Excellent.
absolutely.
That's great.
yeah.
Well, thank you so much for being here today to share these techniques. And I think the more that folks know about the services that we provide and the expertise that you bring to this community, I think that is pretty powerful. So thank you both very much for being here.
Thank you.
Thank you.
Yeah. I'm Jill Bowen, CEO of Northwestern Medical Center. It's been such a joy having Lisa and Sue here to talk about some techniques. So if you have injuries, it's really important to seek out either your primary care doctor or your physician, or even maybe self-refer, because just maybe there is a technique that can help you continue to have fun and enjoy life to its fullest. So thank you for joining us today.